strategies for diabetic retinopathy.
Good afternoon, respected chairpersons and my dear colleagues. I will be speaking. It's not coming out this. Community awareness by multimodal strategies for diabetic retinopathy. As we know, a successful program to combat diabetic retinopathy in part relies upon the level of awareness about diabetes within the community. It appears that awareness of diabetes and diabetic retinopathy is relatively low in many parts of India, making it difficult to engage in preventive actions, diagnosis or treatment. In a study done in southern India, it was found that awareness that diabetes can cause diabetic retinopathy was present in only 28.8% of the urban population. As diabetes has there is lack of awareness and there are no symptoms, and we did a study in this. All study and screening camps were organized in a rural district of the Bagpat area of Uttar Pradesh. In this, a mobile van equipped with the portable angiography and laser machine were taken to the camp area, with the team comprising of the retina specialists, optometrists, counselors. All the patients were examined and visual acuity, dilative examinations were done. All those patients who were found to be diabetic and needing treatment, angiography and laser treatment was done in the van itself. We followed all the three main approaches of the awareness, like mass approach, group approach and the individual approach. Mass approach, public meetings, press meetings and public announcements through posters, banners and TV and radio ads were given. Individual seminar and lectures were held for the small group of patients. Patient interactions were done at the campsite, and booklets in the vernacular language were also published. In the individual approach, all those patients who were found to be diabetic at the patient side, individual counseling sessions were held with the counselor. This is a small slide showing that all the press conferences, seminars and group interactions were seen. Even special days like World Diabetes Days was celebrated in the schools so that the children could get motivated and in turn tell their parents and grandparents to go for the screening. In spite of all this, we were not getting our desired results. We found that all these approaches were useful in urban and semi-urban areas, but were less useful in rural areas. People vary so widely in their socio-economic conditions, tradition, attitude, and level of knowledge, and mixture of different approaches are required. There is attitude that diabetes is a disease of the rich people, and the people who are in the rural areas, they work hard, and so they won't get diabetes. Their lack of awareness about diabetes, and that diabetes can also cause affect vision is also less. So we developed a educational movie. In this protagonist, which is diabetic, is based in the rural area and is repeated consult. I'll just show. It's a small clip of the video. It's a 45 minutes video, which was shown in the rural areas, in the cables and the small theaters. In this, all the procedure of the diabetes, like angiography, laser, were shown in the great detail in the local language, and the patients' apprehensions were allayed with this. The movie also touched the sensitive topic of the quacks exploiting the people in the rural areas and giving them the local medicines or herbs for the treatment of the eyes. Coming to result, we found that in the initial camps, when the normal approaches were found, there are less number of patients who came for the opted for the treatment or they came for the follow-up. But when this movie was shown in the rural areas, in the different cables and small movie theaters, we found there was significant increase in the patient coming for the screening, opting, and there was 27% increase in the patients opting for the laser treatment. In conclusion, we found that people vary so widely in their socioeconomic conditions, traditional beliefs, and attitude that a uniform communication approach is not viable. A mixture of different approaches must be developed depending on the local circumstances, and we have to constantly evolve new methods of screening and awareness. Thank you for your patience.